Hi there, my name is Jim McMorran. I'm a GP from Coventry, GP with specialist interest in diabetes at Coventry Warwickshire Partnership Trust and Editor-in-Chief of GP Notebook. Today I'm going to talk to you about the evidence and interventions for putting type 2 diabetes into remission. There's no official World Health Organization definition of what diabetes in remission is. In 2009, the American Diabetes Association defined type 2 diabetes in remission as either a partial response, somebody's HbA1c was less than 48 and they were on no medication for their diabetes, or a complete response if a patient had a normal glucose tolerance and on no diabetes medication. However, in 2019, the UK Primary Care Diabetes Society and the ABCD, which is the Society for the UK Diabetologists, came together and made a definition for what type 2 diabetes in remission was for the UK. This had three components. One, that the patient had weight loss. Two, they had an HbA1c of less than 48 on two occasions at least 6 months apart, and three, they were on no diabetes medication. There are only two methods that diabetes in remission can be achieved from the evidence at present. That is either via bariatric surgery or via a very low calorie diet. Well, there's evidence that bariatric surgery can lead to putting patients with type 2 diabetes into remission. An international consensus statement in 2016 from the American Diabetes Association and Diabetes UK, among others, suggested that between 30 and 63% of patients with type 2 diabetes who had bariatric surgery could be put into remission. The average time that they would remain in remission was about 8 years, but unfortunately between 30 and 55% of patients would eventually relapse and become type 2 diabetic again despite their bariatric surgery. A more detailed study from Britter et al. Looked at a cohort of over 200 patients who had had bariatric surgery. Their criteria were more strict and they defined remission as an HbA1c which was below 42, i.e. below what we use in the UK as pre-diabetes. They showed that approximately 24% of patients with bariatric surgery achieved an HbA1c of less than 42. Of note was that more patients who had a gastric bypass operation, such as a Roux-en-Y bypass, achieved diabetes in remission according to the standards of the study than other just restrictive interventions. And the evidence would suggest that there is more than just calorie restriction involved in putting patients with diabetes into remission from bariatric surgery. The bypass operations have better results in terms of putting diabetics into remission, and this is suggested to be because of changes in hormonal profiles associated with the replumbing of the gut, which is associated with these procedures. It's suggested that there is like a GLP-1 effect helping to put these patients into remission. So there is a combination of a restriction of calorie intake, but also changes in the hormonal profile that makes it more likely for the patient to remain in remission. Well, the evidence from using a very low calorie diet in type 2 diabetes comes from the DIRECT study from 2017. This study basically recruited patients to a trial where they had 800 calories per day and then a gradual reintroduction of food into their diet. The trial recruits stopped all their diabetic medication and all their antihypertensive medication whilst being part of the trial. At a year, nearly half of the patients who entered the trial and continued with their low-calorie diet, very low-calorie diet, achieved diabetes in putting their diabetes into remission. At 2 years, still 36% of patients remained in remission who adhered to the pro forma for the very low-calorie diet as stated in DIRECT. The most important predictor of remission was weight loss. So if a patient lost between 10 and 15 kilograms of weight, they had a chance of putting their diabetes into remission of about 57%. However, if a patient lost more than 15 kilograms in weight, then there was nearly a 90% chance that they would put their diabetes into remission. This reflects that losing weight for a patient with type 2 diabetes is a very significant contributor to the chance of putting their diabetes into remission. If a patient puts their diabetes into remission, then their cardiovascular risk reduces. So it's estimated that the average cardiovascular risk would reduce from 23% to 7% after 6 months in remission. Diabetics in remission also reduce their risk of having complications such as high blood pressure and cardiovascular disease. Also, they reduce the risk of microvascular disease such as retinopathy, neuropathy and diabetic kidney disease. Well, thank you very much for listening to this short video about putting type 2 diabetes into remission. I hope you tune in again to hear more videos from GP Notebook.